Welcome back to True Health Doctors. Today we have as our special guest Mr. Jorge Gomez. Thank you, Mr. Gomez, for joining us today.
Well, thank you, Dr. Watts, for inviting me.
So let's start with, when did you know something was wrong? When did you know that something was wrong and you start seeking medical attention?
Well, to make a long story short, October 23rd, actually October 22nd last year, been 9 months now. I went to bed thinking I was going to be waking up, same way and like I've been doing for the last 55 years. And 2:30 in the morning, I woke up and I couldn't breathe. I was short of breath. The typical complaints, the pain in the arm. I felt like somebody was sitting on my chest. I couldn't breathe, and the pain in the jaw on the left side, a little bit on the right side, and that was like I think there's something wrong. I'm a pretty consider myself very healthy, and
so up to that point, healthy, just having
no complaints. The only complaint that I had that year prior, I picked up high blood pressure just went up. For all of a sudden, just went up. I went to travel overseas. I was in Bogota, Colombia, which is about 8,000 feet high over sea level, and my blood pressure went sky high, like 177, 117, and then I was like, well, it runs in the family and the genes of high blood pressure. So well, I guess my gene just kicked in. So that was the only sign, because I run a bike. I had ran the Peachtree Road Race last year.
So you were doing all those things. You were very active. You weren't having any problems whatsoever.
Not whatsoever. I played tennis all my life, ran, played soccer since I was 5 years old, and I've been very healthy and active, so no complaints.
And had you been to the doctor and got your cholesterol checked and things like that?
I've been going to the medical doctor, going to my primary care physician. He's internal medicine at Emory, and I've been getting my blood work and exam physical every year on the dot. Every year I will go, and my cholesterol my blood work was always within the norm. The only thing was he pointed out the good cholesterol was always a little bit on the low side. But he said, well, you need to continue doing exercise and watch your diet, eat fish and omegas and fish oil, and I was doing that, and that was the only kind of little sign.
So when those symptoms started, did you know right away that you were having a heart issue, or did you question what was going on?
No, I said the one thing is I never felt like that ever in my life. I had kidney stones, I had appendix taken out, I had appendix attack, but never had those symptoms ever. I mean, I'm pretty in tune with how my body should feel. So I said something wrong here, and then I woke up my wife. Thank God I woke up, first of all. It was at 2:39 in the morning, because I looked at the watch. Sat on the bed and said, doesn't feel good. I stood, and my wife woke up, and she's a nurse practitioner, pediatrics, and she worked at ER for many years. And she asked me, what's wrong? And I say, I have chest pain, cannot breathe, my arm hurts, my jaw hurts, my arm. And she's like, are you dizzy? I say, yes. Are you queasy? I say, yes.
So she knew immediately
what
was going on.
Okay, are you sweaty? I say, yes. It's like, that's not good. That's signs of a heart attack.
Right down the checklist right there.
Yes, she went through the checklist.
Yes. So did you call 911?
Actually, which is, no, you need to call 911.
Yes.
Although she's a provider there with me, and she's like, let's go to the hospital. Thank God we live 1 mile away from the hospital, north side. So she thought I was having like an angina or pre-heart attack. Not I was having a heart attack. And we just let's get on the car, and we drove. It took us 3 minutes to get to the hospital. It's 1 mile away. There was no traffic at that time. I walked in, and as soon as the doors open, I say, I need help. My wife's a nurse practitioner, and she believes I'm having a heart attack. They told me, sit on that chair, and we brought a wheelchair, took me to triage, and within 2 minutes they had me connected, and they said, yes, you're having a heart attack.
Okay. So then what happened then? What other tests or treatments did happen?
As soon as she said the doctor and then the attendant came in, and she said, well, you're having a heart attack, Mr. Gomez. We already called the cardiologist, and we're going to start treating you. And right, they put me on a stretcher there and the hallway, and they start working on me. Like 8 people showed up, and there's lines and medicine, and they wheel me into the room and give me the nitro one time, and didn't do anything, so they gave me another pill of nitroglycerin, and nothing happened. And we just kind of I felt like I was going down.
Wow.
I was shutting down.
That was scary. That had to be scary.
It was pretty scary, but 2 things. One, it was just happening so fast. Second is, I had the peace of the Lord in me. I mean, I'm a man of faith, and I knew I was in good hands. Regardless of what happened, I was in good hands, in the Lord's hands. So I was just pretty much trusting God that God was going to take care. I was just praying the whole time and calling out to to God. So when they brought me into the room to start, more people came in, and the doctor came in, Dr. Bendick, I still remember the name, and she came. She was like maybe 5 months pregnant. And she said, "Mr. Gomez, you're having a heart attack, and the doctor is on his way. We're talking to him right now on the phone, so he should be here, and he's going to take care of you." And she walked away, and they were going to do an X-ray of me. They brought the portable X-ray machine, and they put them turning. They put the film behind my back, sat me up, and that was it. I don't remember anything else after that.
Oh wow!
I just went passed out, and went into a cardiac arrest.
Oh wow! A
So
full cardiac arrest.
Yes.
Oh my! Now that I know that gets doctors very nervous and very scared at that point.
So was your wife in the room at that time?
Well, my wife was, she when they brought me in, and she was standing right there at the door of the entrance of the room, and she was just there waiting. I think she was calling somebody, and a friend of ours, and all of a sudden they called a code blue on me, and she's like, "Wait a minute." She looked around, and they were doing CPR on me. They were using the bag and then doing chest compressions. So, and then somebody came and grabbed her and took her away to a room, and here comes the cart, the crash cart.
And that's really the scary thing about these heart attacks is that when something like that starts, you may literally have just a few minutes, and you don't know when that person may actually go into a complete arrest.
Exactly.
And so that's the thing. So I want to know, when you woke up again, where were you? What was going on?
It was thank God they got me. They shocked me and brought me back. Because I was, and I share with you, I was on my way to heaven, so I was happy. I was just like strolling to heaven through the tunnel, but and I was being led, but 2 angels, like the Bible says. I was being led, and all of a sudden I felt like somebody grabbed me from the back and yanked me, and then I opened my eyes, and the doctor was getting ready to put a tube on me, getting to be intubated, and then I opened my eyes, and she said like, "Oh, Mr. Gomez, welcome back."
Wow.
So you gave us a big scare, and everything is now stable, and doctors, we're going to take you now for a procedure. So that's when I woke up.
Wow. Well, that's an experience. I hope it's an experience not much a lot of our listeners out there do not have.
No. And the one thing I'm glad you mentioned, did we call 911? We did.
Yeah.
We should have called 911.
Yeah.
At least, although my wife is a nurse practitioner, but if you don't have a doctor right there, or a nurse practitioner, or a nurse, you need to call 911.
Yes.
Anyway, you have to call 911.
Yeah, because you literally could be dealing with seconds or minutes.
Exactly.
And time is of the essence.
If I had the cardiac arrest at home, it would have been a different story.
Yeah. Or, I mean, even scarier, what I think about is because amazingly, some people will wake up, have those symptoms, and will say, "Listen, I'm going to try to go back to sleep, and I'll feel better in the morning."
Exactly.
And you're right. If you had somehow managed to go back to sleep, you would not waken up again.
No, because I was shut down, and usually I think the usual response in especially us men that don't like to be sick and don't want to go to the hospital.
Yes.
Oh, it's something that I ate.
Denial. Yes.
Something that I ate. I'm going to be fine. I'm just going to take some acid reducer and then go back to sleep.
Yeah.
Sure.
So I'm curious. I mean, going through an experience like that, what has changed now? I mean, how is life different as a result of that, or is it different?
It is different. I love it. I'm always been a very happy, outgoing, a person, very grateful. And I said, like, I was grateful before, I'm even more grateful. I was happy before, I'm happier now. I was blessed, now I'm even more blessed. It just changed my life to just enjoy every minute of it, like if it's the last.
So did you make any kind of changes in your lifestyle or in what you're doing on the...
Sure
although
have.
you were doing healthy things.
I was doing healthy things. The one thing is, talking to the nutritionist. So the hospital was just an amazing hospital, and there's a lot of godly people over there that took care of me. But changes, not too much drastic. Stay away from the breads. I stay away from the breads, which I love breads. The red meats, the cheese, and dairy products. I love dairy products. I was brought up in a dairy farm. My grandfather had a dairy farm, so I drank milk all the time. Milk for me was the drink, and we didn't drink sodas or juice. It was like milk all the time.
I have to sort of interject here because
Yes.
there's some people who think if you take away the red meat, you take away my dairy, I'm going to just be so unhappy. But you said you were happy. You already said that you
Yeah.
were very happy. So
Yeah.
you're getting along without some of
I'm
these
getting along.
things.
Now, this is the thing. I mean, it's like the nutritionist say you can eat well 6 days of the week, and then one of the week, and eat the things that you enjoy, but a moderation. So they just go there like
I see.
eat half of a cow.
Oh, okay.
Yeah, just moderation. Not milk. The cheese I eat like a part skim mozzarella, which has the lowest, and then I just have only. I used to eat like half of a cheese in one setting. Now just 2 slices.
I see.
It just and then the bread I just like. You just have a little bit. Okay, I have my taste of bread. No more donuts. That's it. No more
Okay.
donuts.
All right.
No donuts. If I'm going to have a donut, it better be something that is a cake donut or something. But
Thank you very much for joining
Yeah.
us today.
Yes,
It
sir.
was very good for you to be here. And again, we're just here to inform, inspire, and empower people to make changes and to know, like yourself, you can go on and still live a happier, healthier life,
Yes.
even
Yes.
after disease.
yes, indeed.
Yes. Thank you so much. You
Thank
are
you.
an inspiration. Glad to see that you're enjoying life in spite of this and that you're a happier person for it. And we hope that you'll live to see many more years. Many
Thank
more.
God. The doctors say I had a heart for all the way to 98. So
Praise it.
praise God.
It's a long time.
Yes, it
That's a
is.
long time.
Indeed. Thank you so much for inviting me and
Thank you. Thank
allowing
you
me to
very
share
much.
my testimony.
Thank you. We'll be back right after these messages.